As we go through the process of aging, we lose volume in our faces, and one of the places that we see volume loss significantly is in the lips. The lips typically show more volume in the lower lip than in the upper lip, and normally the ratio is approximately 1/3 in the upper lip and about 2/3 in the lower lip. So the normal dimensions of the lips are that the lower lip is larger than the upper lip, and so it's always important that when we do lip augmentation that we respect that harmony of the lip size and the lip shape. Frequently, when lips are injected with various tissue fillers, and most people now use only temporary tissue fillers such as Restylane or Juvederm, we want to be able to preserve the proper lip dimensions, and we want to be able to give a natural looking lip with a little bit of augmentation, achieving a little bit of better lip definition so that the lips do not seem to be overdone. And that is probably the most important thing, because we have all seen pictures or photos of people that have had their lips done where there's certainly too much augmentation, or the lip dimensions, the lip definition is not well respected. So typically when we inject the lips, it is to give a little bit of projection, particularly in the very center part of the lip, above and below. We frequently will inject along the lip margin in order to give better lip definition for women in which there is a loss of volume, and also in women in which the lipstick runs into the lines. Being able to inject along the vermilion border will be able to restore that lip definition and prevent some of the lipstick from running in those areas. When we inject the lips, it is important that we keep the area well frozen, because the lips are a very, very sensitive area. So typically we will either apply a topical gel onto the lips that will give some freezing. In some individuals we will do nerve blocks. In most individuals, however, what I find works the best is a topical preparation to freeze the lip, and then also injecting a product that already contains some silocaine or lidocaine that will freeze the lip as we go along to make it as comfortable as possible. Also, by using a very, very small syringe, and frequently I will remove the product and put into a very, very fine syringe with a very small needle, that will also minimize the degree of discomfort that individuals feel. Frequently the lips will be frozen for an hour or so after the procedure is done. There may be a little bit of feeling of lumpiness, but usually that dissipates or disappears with time. My feeling with respect to lip augmentation is that it's better to go gently and to go slowly. If individuals need more product in the lips, then they can easily come back and have it done again.